Hello everybody, in this video lecture we continue covering the urinary system. This is chapter 25, part 2. As we already mentioned, here we have organs of the urinary system. Kidneys are the major excretory organs. Then urinary bladder, that is a temporary storage reservoir for urine. Ureters, right and left, transport urine from the kidneys to the bladder, and urethra transport urine out of the body. In the first part, we already cover information about kidneys. So we talk about kidneys macro anatomy or gross anatomy. We talk about micro anatomy of kidneys, and we, in a good details, talk about structural and functional unit of the kidneys, that is nephron. In this part, we will cover the rest of the organs, ureter, urinary bladder, and urethra. So on this diagram, just to remind you, kidneys, ureters, and urinary bladder and urethra. Ureters. Ureters are these tubes over here, and they convey urine from kidneys to the urinary bladder. The same as kidneys, ureters are retroperitoneal, and they enter the base of the bladder through the posterior wall. As blood pressure increases, distal ends of the ureter close, preventing backflow of urine. On this slide, you see histological slide of the ureter, and there is a lumen or space inside. Then the wall of the ureter is made from mucosa, submucosa, muscularis, and adventitia. So mucosa is transitional epithelium. Then we have lamina propria, and muscularis include longitudinal layer of muscle and circular layer of muscles, and adventitia is connective tissue covering the external surface of the ureters. Renal calculi. Renal calculi are kidney stones that form in the renal pelvis. On this diagram on your right, you see this is a renal pelvis, and here are some stones formed. And those are crystallized calcium, magnesium, or uric acid salts. Larger stones can block the ureter, as you can see over here, and it can cause pressure and pain in kidneys. And this condition can be due to chronic bacterial infection, urine retention, increase of calcium in blood, increase of pH of urine. Urinary bladder. Urinary bladder is a muscular sac for temporary storage of urine. The same as kidneys, the same as ureter, urinary bladder is retroperitoneal. It's located on pelvic floor, posterior to pubic symphysis, and pubic symphysis is the fusion of two hip bones. So we have a right and left os-coxa bones or hip bones, and they join in this region by a special cartilaginous joint called pubic symphysis. In the males, prostate gland surrounds the neck of the urinary bladder inferiorly. So just below the urinary bladder in males, we would have prostate gland. In females, urinary bladder is anterior to the vagina and uterus. Now on this diagram, you can see urinary bladder and a specific triangular area that is formed by three openings. So this is the opening of the right ureter, this is the opening of the left ureter, and this is the opening of the urethra. So if we connect these three openings, we form triangular structure, and it's called trigone. Trigone is important because infections of the urinary bladder tend to persist in this region. Urinary bladder has three layers in its wall, and its transitional epithelial mucosa, then a thick layer of muscle, it's called detrusor muscle, and adventitia. And detrusor muscle has three layers of smooth muscle. So inside mucosa, and that's transitional epithelium, then we have lamina propria over here, and a muscular layer that's called detrusor muscle, and adventitia on the exterior surface. So urethra is a muscular tube. Lining epithelium is mostly pseudostratified columnar, with exception of transitional near to the bladder and stratified squamous next to external orifice. So on this diagram you see male urethra and female urethra, and this gland inferior to urinary bladder is prostate gland in male. So urethra has two sphincters, internal urethral sphincter and external urethral sphincter. So internal urethral sphincter is involuntary. It's a smooth muscle at bladder-urethra junction. So here's the bladder and here's the urethra. So right here in this area at the junction, we have internal urethral sphincter, and external urethral sphincter is inferior, and it's located within this pelvic diaphragm. This one is voluntary, made of skeletal muscle surrounding the urethra when it passes through the pelvic floor or this pelvic diaphragm. So two sphincters, and sphincters opens when a person is ready to urinate. Female urethra is shorter, about 3-4 centimeters, tightly bound to the anterior vaginal wall. External urethral orifice is anterior to the vaginal opening and posterior to the clitoris. So on this diagram you can see female urethra. Here's our ureters, trigone, right? Urinary bladder, urethra, urogenital diaphragm or pelvic floor, and here internal urethral sphincter, and that's external urethral sphincter. This opening is called external urethral orifice. Male urethra carries both semen and urine. However, semen and urine never mix, and a male urethra is longer and it's divided into three regions: prostatic urethra, membranous urethra, and spongy urethra. And spongy urethra passes through the penis and opens via the external urethral orifice. And spongy urethra is the longest part of a male urethra. So on this diagram, we can see better all the parts that we need to know. So we're going to start with two ureters, urinary bladder. Here's a trigone over here. And that's the male urethra that is pretty long, right? Part of the urethra passes through the prostate gland, and it's called prostatic urethra. Then part of the urethra passes through this urogenital diaphragm, and we call it membranous urethra. And part of the urethra runs inside the penis, and it's called spongy urethra. And here it opens to the exterior through external urethral orifice. Right, so that's a prostate gland. These two glands over here called bulbourethral glands. We will talk about it when we cover reproductive system. And this is the last slide in this presentation. Micturition is urination or voiding. And for micturition, we have three simultaneous events. Contraction of detrusor muscle by autonomic nervous system. Detrusor is a smooth muscle of the urinary bladder. Then opening of the internal urethral sphincter, again when signal is received from autonomic nervous system, reminding you that this is actions that you do not control. And then step number 3, opening of external urethral sphincter by somatic nervous system, and somatic nervous system under voluntary control. Okay, so we finished chapter 25, the urinary system. Make sure you watch both part 1 and part 2, and I hope it was helpful.